And when we talk about what is the risk of this melanoma, what's the danger of this melanoma? Well, when we catch it early, when we catch it at a melanoma in situ or stage 0, we can see that the risk is extremely low. And this study looked at just that. What is the mortality of a melanoma in situ? And in this study, they looked at a 15-year melanoma specific survival and a 15-year relative survival, which is when you compare two groups, one group that had a melanoma and one group with similar individuals that did not have melanoma. And what they found was that there was a slight increased risk of death in patients that had the melanoma, which is a melanoma specific risk. But if you looked at the two groups, there was a decrease of mortality in the patients with melanoma than the patients without melanoma. And you'd be saying like, what? How is that possible? Well, when patients start seeking care and they're starting to establish care with doctors, physicians, dermatologists, primary cares, they are patients that are actively procuring health. They are trying to improve their health. They are wanting to stay on top of their skin checks, their regular screenings with their primary care doctors. And so by doing that, we are able to catch things early before they become a problem. And once they're diagnosed with melanoma, that may change how a person behaves in terms of their diet, in terms of their health, exercise, etc. And so finding a melanoma early is actually protective. And we believe it's because a patient is seeking care, seeking health, and making lifestyle changes that benefit them in the long run.